Okay, just a reminder, this session is being recorded, so if you prefer not to have your video on, that is no problem. Welcome, everyone. My name is Annie Lindy Kugel. I use she, her pronouns, and I am the Executive Director for the Community Services Network. And I'm super excited to be here with Stephanie Oxshire from Care Oregon and Dave Fife from Care Oregon, who's just joining us as well. Awesome. Okay, so today is a third part of our HRSN benefit series. And Ifoma, sorry, is also, Ifoma Motu is here as well, I think. My apologies. Okay, great. So it is the third part in our series. And this one is really for CBOs to understand how this service or this benefit might be embedded into the CBO. Into your nonprofit. So our plan for today is to review information from webinar number 1 and 2 about the health-related social needs benefit and the CBO roles, to define the common contract elements and identify some ways that the CBOs can prepare for HRSN contracts, and then discuss funding available for capacity building and the CBO that supports, and the support that the CBOs might need to participate in the HRSN benefit. So those are the three kind of main focus points, and then to go over also any questions you might have. Next slide. Great. And these are the questions. As you know, we send out surveys at the end of these, and it gives you an opportunity to ask any questions. And so last time we didn't have too many questions, but here is one. Is there an opportunity to provide input into the development and rollout of the 1115 waiver? So I will let Stephanie, you'll answer that during the session, correct, Stephanie?
Yeah, we do have a survey link here. So if you want to share other questions or kind of input that you would like us to hear as Care Oregon and CSN, we're happy to receive that feedback through the survey link. And then at the end of the webinar, we do have a slide that has some links to OHA's website, and OHA has been hosting a webinar series as well that we encourage you all to participate in, as that is an opportunity to provide feedback directly to the Oregon Health Authority.
Perfect, thank you so much. Okay, so this is where we're wanting to kind of get to know the room a little bit. If you can take a few moments to let us know in the chat, has your organization partnered with a CCO or other healthcare organizations in any of the following ways? And if you just put that number in the chat related to the content. So number 1, received grant funding. Number 2, provided technical assistance. Number 3, contracted for direct services. Number 4, participated in a learning collaborative. Or number 5, another way that we missed. Take a few moments. Take a peek at the chat. Awesome. A big variety. So no to all 4 questions. Okay. 5, 4, 5, 1. Awesome. Okay, so a couple of you. Great. Well, this webinar can give you some information as to how you might be able to participate in the future. Next slide. All right. The HRSN review. Stephanie, would you like to take this one? Thank you so much.
Yeah, thanks, Annie. So as Annie mentioned, we're going to spend most of our time today talking a little bit more about CBO roles and supporting the health-related social needs benefit and what it would look like potentially to contract to provide services through the HRSN benefit. But before we did that, we did want to review some of the content we've covered in our last 2 webinars. For those of you who've been able to join us, this will be a little bit of a review and refresher. For those of you who haven't been able to join us, this will be just a quick review and overview of what the health-related social needs benefit is. So let's start there with what the health-related social needs benefit is. So the health-related social needs benefit, or HRSN benefit for short, was passed through the 1115 demonstration waiver process last year, which is a process which allows Oregon the chance to add or change terms in our state Medicaid contract with the federal government. So Oregon had proposed to add this benefit and was approved. So the goal of the health-related social needs benefit is to provide social supports to OHP or Oregon Health Plan members who are experiencing certain life transitions to improve their health during and after these transitions. The benefit will include support for 3 specific health-related social needs, which are housing, food, and climate. The benefit will roll out slowly over the next few years, starting next year. It will start with the climate benefit, which will become available January 1st of 2024. 1 year later, the food benefit will launch on January 1st of 2025 for all eligible populations. And then the housing benefit will roll out a little bit more slowly. It will start with focusing on one population, which is individuals who are at risk of becoming homeless, starting November 1st of next year, 2024. And then at a later date, we don't have a date yet when the housing benefit will roll out completely, but that will be available no sooner than 2025 for all remaining eligible populations. So this is a draft timeline. Oregon is still in the process of seeking approvals from the federal government for our plan for the health-related social needs benefit. So this timeline might change, and some of the content we're sharing today is also still being negotiated and finalized with the federal government. So as we talked about earlier, the benefit will provide support for climate, food, and housing needs. And there are a specific list of services and resources that will be available through the benefit. So in terms of supporting climate needs, support will be available for medically necessary air conditioners, heaters, air filtration devices, personal power supplies, and refrigerators. The benefit will cover these devices as well as support for installation of these devices. The housing supports that will be available include rent and temporary housing assistance for up to 6 months, utility assistance for up to 6 months, pre-tenancy and housing navigation support, tenancy sustaining services, one-time transition and moving costs and deposits, and medically necessary home accessibility modifications. The food supports that will be available include nutrition, counseling, and education, medically tailored meals for up to 6 months, meals or pantry stocking for up to 6 months, and fruit and vegetable prescriptions for up to 6 months. So I mentioned some eligibility criteria. Similar to other Medicaid benefits, there is eligibility criteria to access the food, housing, and climate supports through the health-related social needs benefit, which includes a couple of different requirements. So the first requirement is that individuals must be current Oregon Health Plan or OHP members to access the benefit, as this is a Medicaid benefit. The benefit is focused on supporting individuals experiencing life transitions. So there is a list of life transitions that qualify. That includes youth involved with the child welfare system, including youth leaving foster care, people experiencing homelessness or at risk of homelessness, people released from custody or residential behavioral health settings, people transitioning from Medicaid only to both Medicaid and Medicare coverage, and youth ages 19 to 26 with special health care needs. There's an additional life transition that does qualify during a very specific event, which is people living in an area experiencing an extreme weather event. During and kind of immediately after those weather events, individuals who are in those areas do qualify for climate support as well. So in addition to being an OHP member and experiencing a life transition, individuals will need to have a social health need, specifically a food, housing, or climate need, and have a clinical health need to qualify. Some examples, this isn't a complete list, but a couple examples of what we mean by clinical health needs are complex physical health needs, mental health conditions, pregnancy, or age, such as being under 6 years old or over 65 years old. Okay. So given all of this eligibility criteria, let's talk a little bit about what it will look like for an individual or a member, as we call the individuals we support, to connect with the health-related social needs benefit. So the first step would be that the member learns about the benefit and is interested in support. This could happen in a variety of different ways. Maybe this individual, this member, connects with a community-based organization and learns they might be eligible. They might hear directly from their coordinated care organization that they might be eligible. They might just kind of hear about the benefit in the community. So that first step is that they would learn about the benefit. If they are interested, they would then participate in a screening to determine their eligibility. and confirm that they can access these supports. So that first step of screening would really confirm that they're experiencing a life transition and that they have one of those social needs, housing, food, or a need for climate support. That screening information would then be sent to the member's coordinated care organization, and the CCO would confirm that that member has clinical needs and meets that clinical criteria. Once all of the eligibility has been confirmed, the CCO would then approve services and develop a care plan to support that member. The member would be connected to a health-related social needs service provider, which in many cases would be a community-based organization. And then that community-based organization or health-related social needs service provider would work directly with the member to meet their needs. We've talked a bit throughout this webinar series about the role of coordinated care organizations or CCOs with the HRSN benefit. So just as a reminder, CCOs are Oregon's approach to managing Medicaid. CCOs are responsible for managing and coordinating their members' benefits. So as the health-related social needs benefit rolls out and becomes available, all CCOs across the state will be building out new systems, processes, and networks to support the benefit implementation. We also talked during our last webinar about potential ways for CBOs to participate in the benefit. A couple of roles that we identified were sharing about the benefit with the community, perhaps participating in screening individuals for eligibility, and then finally providing health-related social needs services directly, those food, housing, and climate supports. And that's what we're going to spend the rest of our time talking about today, what it would look like to participate in providing HRSN services. So we also talked kind of over the last two webinars about some of the requirements to participate in the benefit as a HRSN service provider. So this is really focused, these requirements are really focused on things that you would already be bringing, capabilities you might already have. So things like knowledge of the principles, methods, and procedures for providing food, housing, or climate supports, having strong community relationships, being able to provide trauma-informed and culturally and linguistically responsive services. However, some of these requirements don't really give the full picture of what would be expected of a community-based organization and to kind of do as a health-related social needs service provider. So that's what we're going to break down next today to talk a little bit more about what it would be like to participate, what a contract might look like, so that you have a better idea of what to expect and can evaluate if this is the right opportunity for you. So Dave is going to talk a little bit more next about what it might look like to contract to provide HRSN service. Dave, are you ready?
I am.
Okay,
Audio
great.
check. Do you hear me? Great.
We hear you.
Well, thanks everybody, and apologize if there's a little bit of an echo. This is my usual spot to do these webinars, so hopefully that's not an issue on your end. But we at Cure Oregon have spent the better part of the last 3 years trying to understand how to bridge this Medicaid CCO and community-based organization gap. We've learned a lot of things about the different languages that we speak. The Medicaid world speaks a language that's kind of steeped in regulation and healthcare, and community-based organizations speak a language that's steeped in community and individual need. And so, as we have worked with CBOs to develop contracts for their services, we've learned that sometimes understanding some of the more high-stakes language around contracts is a really important thing to level the playing field and make sure that everybody is coming to the table as equal partners. So we're going to spend some time talking about some elements of contracts, because each of your CCOs that you work with in your various regions are going to need to develop a network of service providers to provide these benefits. And the way they're going to do that is via contracts. So CCO contracting approaches may vary. Their templates may vary. What the language says may vary. And since Cure Oregon isn't involved in every CCO in the state, we can't speak to specifics necessarily about what your contract will look like. But there are some elements that are really standard across contracts, And if you can go into conversations with your CCO knowing what those might be, we're hoping that you can do that, go into that conversation with a lot of confidence and asking questions that are really important for you to be a successful partner in this benefit. So we're going to go ahead and kind of think through this. Our goal is to help you feel empowered. We want to recognize, though, that the power dynamics are real between funder and fundee, between healthcare and community. There's a lot of power and politics that we have to keep in mind. So our hope is that we're leveling that playing field. We're going to go through a number of different likely elements of a HRSN benefit services contract. And for each of those elements, we're going to discuss things that you can do to prepare. So some resources that you can reference before conversations with your CCO so that you feel like you have all the information at your fingertips. We're going to talk about things that you can do to reflect. And these are internal things as you think about your organization, your alignment and readiness to support this kind of work. And we're going to give you ideas around what you could clarify by bringing questions or concerns or ideas to the table as you discuss things with your CCO. So we'll go through each of these with that in mind, of things that you can prepare, reflect upon, and clarify with your CCO once you get to that point. So on the next slide, this showcases the 8 elements that we're going to go through. You may not see all of these elements with your particular CCO contracting approach, or there may be elements that are not on this slide that are going to be really important. We encourage you to work with CSN and other supports so that you can find a way to get the answers to your questions and feel comfortable when the time comes for it. But these are elements that we think have a high likelihood of being involved in your contract. So for each of them, we're going to get into some details. The first thing that you might see is an element of your contract that indicates covered services. So what does that mean? That's definitely a healthcare kind of a term. So this is a list of services that are reimbursable through the contract. So think of it as a list of what's on the menu, so to speak, for the services you can provide to people who need your support. It could be called a scope of work as well, and it includes definitions of the services. It may even include details like the duration that's allowed or the frequency that's allowed. And those details are really important in making sure that you're on the same page with the CCO you're working with. It may also include criteria on who can receive services. And we've had a great conversation in the chat around a really specific use case, and being really clear on that eligibility, or the who, is also a key element to scrutinize in any section that you see called covered services or scope of work. And will likely include clauses that indicate that someone needs to be a member of the given CCO and that they meet this HRSN service-specific eligibility requirements. So hopefully our webinars have given you a good sense of what that might look like and what those eligibility requirements could be once they're in a contract form. It may also include processes for connecting individuals to services. So requirements around screening and referral processes, and even information on how the CCO is going to authorize those requirements. So a lot of the nuts and bolts of the what's covered and how. So as you think about those covered services, there's a couple things that you can do to review and be prepared for that conversation. There are what are called the service protocols, which are the rules of the road established by the state and federal governments for what they expect from this benefit. Knowing that is going to prepare you to understand what to expect in that contract. But we also welcome you to, when you get to that point, go ahead and look at that second webinar we did, where that went into a lot of detail about what is covered in those service protocols as of the date that we gave that webinar. A couple of questions that you may want to reflect upon as an organization is determining whether the HRSN benefits reflect the services that you provide. Is this a good fit for you as a service provider? And are there services that maybe you don't offer but would like to? You can also ask yourselves, how do you currently assess needs, and what further assessment might you need to comply with the HRSN requirements? Are you doing it in the way that's expected in the contract, and is there flexibility to change, adapt, or incorporate those requirements? And are you able to accept and communicate about referrals? We talked about in our last webinar how closed-loop referrals are a key element to being successful in communication of this benefit. And reflecting on what resources, what other people or technology or elements of your model might you need to serve people in this way. And when it comes time to coming to the contracting discussions, some key questions you may want to consider asking and answering along the way are, how will referrals be sent and accepted? And what are the expectations for closing the loop and communicating about referral status? Get real clear on what the expectations are so it can be a great partnership. What will be the process and timeline for service authorizations? What can you expect from the CCO as you hold them accountable as an equal partner in your contract? And how many members will need services each year? Are there volume expectations that the CCO has for your CBO? That makes sure you're on the same page for how many referrals might be coming your way and whether you are adequately prepared for that capacity. Clarifying those kind of elements will really help you be prepared for a successful partnership when it comes to these covered services. I'm going to go through one other element, and then we're going to pause periodically for questions, since this is a lot of information and you all might be interested in some follow-up questions. For the next one, we want to talk a little bit about payment. So a contract is going to include terms around payment. So some terms that you might see here, what they mean, first might be rates. So that's the amount that the CCO is going to pay for each of those covered goods or covered services that are part of the benefit. It should include all the costs associated with providing a service. So if you're thinking about, for example, providing medically tailored meals, you should make sure that you should recognize that the rate is meant to cover not just the food itself, but the preparation of the food and the delivery of the food. So as you think about rates, make sure that everything it takes to actually perform that service is included in that rate, and that rate makes sense for your organization. You might have information around payment types. So this is determining a little bit of the how services will be paid for. So it could be providing a predetermined fee, or paying for the actual cost of an item, or paying based off of a number of members who are served over a particular time, maybe like a case rate. You may also have information about when the payment is going to be provided. So are you going to get reimbursed after a service is provided, or are you going to receive an advance payment that will be reconciled? And is there information in the contract about how that reconciliation works so that you feel well prepared for when it happens? You may also have a lot of information in your contract around the payment process. So what information needs to be documented and submitted on an invoice for it to be accepted by the CCO for payment or for reconciliation, as the case may be. And what is the CCO's process for invoice review and approval? Again, contracts cut both ways. So what is the expectation of processing time on the CCO so that you understand for your cash flow what you can expect? And that gets right into payment timelines. So when are they due? Is there a particular cadence? Is there a limit for how long you can wait to submit them? Most contracts aren't going to accept things that are 5 years old, for example, as an extreme case. So being really clear, how long do we have to submit an invoice or a request for payment or reconciliation? How long it takes to provide the payment, how long until that check comes, and the process for correcting payment errors. So as you think about payment, which is a really important thing to think about as you enter into these contract discussions, again, the service protocols are a great back pocket piece of information. OHA will also be providing a publicly available fee schedule about what the basic expectations for payment are. So understanding what the basic expectations are allows you to have maybe more advanced discussions around different hows and whens and whys that are pertinent to your specific organization and approach to providing community supports. And understanding your own organization's budget actuals is really important. Understanding what your cash flow is and whether you can support that level of need with a reimbursement approach, or whether you'll need an advance payment in order to be a good partner. These are things that you can bring to the table to be really prepared. And as you reflect in preparation for these conversations, a couple things to maybe ask and answer for yourselves is, what is the true cost of services? Understanding what it costs to deliver services really puts you in a great position to negotiate maybe particular rates, or recognize what is a rate at which you couldn't be a partner as an HRSN service provider. And you should consider staff times and benefits, direct supervision costs, supplies, admin expenses, and even travel if that's relevant to the services that are provided. Do you have adequate financial processes to track services and costs and accurately invoice? As this kind of kicks into gear, there's going to be a lot of information going back and forth between your organization and the CCO about these services. Do you have the organization already kind of figured out for how you can track that in case somebody asks a question around a service that was provided 2 months prior? Are you able to get that quickly so that you can answer and resolve any problems that might come, just as an example? And are you able to wait for reimbursement, again, related to cash flow, or do you need to receive any amount of funding upfront? When you come to the table, a couple of things we really recommend clarifying is, what is the rate for each service provided? Making sure that you understand from the contract language what money might be coming and for what, and what information needs to be included on the invoices so that you don't have to start, stop, or do the invoice process more than once. Getting it right the first time, always best for everyone involved. Understanding when payments will be provided and what support is going to be available to your organization if there are errors or issues, all great things to clarify so that you know exactly what you're working with. We're going to pause there before we go on to the next one in case there are any questions that people want to put in the chat or verbally raise. All right, I'll keep going and we'll have another chance for questions in just a second. The next element that you might find in a contract with a CCO is related to data. So what you might see here are reporting or data requirements. So most of this is probably going to be captured in the invoice itself, but your contract may contain additional information that needs to be documented and submitted to the CCO. It may include a member ID or HRSN benefit eligibility or info about the services provided or specific items that you provided. You'll want to make sure that you look carefully at those expectations and make sure that they are right for your organization. You will also likely see some requirements related to data access and sharing. And so that might be how you're accessing certain CCO data systems to understand things like, what is a member ID and what is it for the person that I'm helping right now? But also might have rules about how data can be shared. It will also likely have requirements around securely sharing protected info. We treat data privacy really seriously, and we're going to get into that a little bit in the next slide. But understanding what are the appropriate ways in which we're sending information that does identify individuals, and what are the safe ways to do so is likely going to be part of the contract that you would sign with CCOs. Getting into that more deeply, healthcare is governed by a data privacy regulation called the Health Information Portability and Accountability Act, or HIPAA. And it's really just designed to protect the privacy and security of the people that we serve. Their health information is really sensitive. And so anything that is personal health information or individually identifiable is covered by this regulation. And under this regulation, CCOs are governed by the rules. And what they can do is bring more people into the data sharing agreements through business associate agreements. So under these rules of HIPAA, community-based organizations would be called business associates. So if you see something called a business associate agreement in your contract, what that means is it's an agreement around data sharing that uses language that comes directly from this law, from this regulation. And that regulation governs how information is collected, stored, transmitted, and maintained. So in your business associate agreement, as part of your contract, you will likely see some expectations around that. And that's going to govern anything that is considered personal health information. And that's also defined in this law, but the really kind of short version is, this is information including demographic data that identifies the individual and relates to either the individual's past, present, or future physical or mental health. And we're thinking of this broadly as related to someone's health, the services that are provided here. It includes any services that they were given, and it includes the past, present, or future payment for the provision of healthcare to the individual. So we treat that information really seriously. So when you see a contract with a CCO that has a number of pages dedicated to data privacy, I hope that explains a little bit of the why there are so many pages. And you should be well within your rights to ask a lot of questions here, which moves us on to the last slide on this particular section to reflect and prepare and to clarify. In addition to the service protocols, we really encourage you to be familiar with any OHA data requirements if they become available. And we provided a link in these slides for additional information and training on HIPAA or data privacy requirements in case you want to understand that a little bit better before engaging with CCOs on these services. Some questions for yourselves or to ask of your own organization includes, is your data collected and stored in a way that will allow you to meet these these requirements. And again, sometimes the requirements can be overwhelming. The biggest thing is, can anyone access this that shouldn't have access to it? And answering that question around your current data collection and storage processes is really important to bring to the table. You may also want to look at, how do we currently ensure that our data is stored, accessed, and transferred securely? Again, getting to some of the requirements that might come in that part of the contract called the business associate agreement. And what else might you need to do to comply with HIPAA? And are you prepared to do it? Including, do you need any additional data infrastructure so that you can meet those requirements? And that might be software, that might be training, that might be staff. When you come to the negotiation table, some things to clarify with your CCO to make sure everyone's on the same page includes what information will need to be documented about the services and the members receiving the services, understanding what that data expectation is, and is there a required format or are there standards for reporting? Making sure that those are stated instead of assumed is a really key part of being successful in a contract. You may want to clarify what data or access to data systems the CCO will provide you. So you're not doing this all on your own. Do they have help and support that they can provide you? And again, how will that data be securely shared? The back and forth of data is where it gets most vulnerable to bad actors acquiring it and using it for inappropriate ends. And so the transmission of data back and forth is a really important component here. Moving on to the next section, after which we will again pause for questions and get into that, is compliance. So similarly to the data privacy requirements, healthcare operates under a number of requirements that are meant to make sure that the actions that CCOs take and that their partners take are in the best interest of members. And that includes any Oregon administrative rules or Medicaid regulations. So you might see references to things called OARs. And these are rules designed by the executive departments of the state on what the rules of the road are in implementing new programs and laws. And so these may include requirements to participate in additional training around fraud, waste, and abuse, so misusing funds or misrepresenting what's been done on behalf of a member, so that you are in compliance with understanding those regulations and that you're attesting that your processes aren't creating fraud or waste or abuse. And there may be requirements around licensing or registration, and these include your own insurance that you maintain as an organization to ensure that everything that happens inside your doors is covered in case of liability or loss. But also might be registration requirements for the organization and or staff. For example, there may be requirements around traditional health worker certification. There also may be audit requirements in your contract. And what this means is just expectations around how the CCO is going to periodically connect with you and make sure that you don't have any questions around how to provide the services, and make sure that you are supported in providing things and supporting the services in the right ways. Some things to bring to the table as you prepare for this compliance element. You can prepare by, again, from beyond the service protocols, understanding and asking around and finding any administrative rules that are related to the benefit. As you reflect about your own organization, you can think about what types of insurance, accreditation, licensing you already have. What are you already bringing to the table that likely satisfies many, if not all, of these requirements? Do you have policies in place that support high quality documentation where you can already with clear
Dave, I think we lost your audio.
Yep, I think so as well. Dave, I'm going to mute you and unmute you and see if that helps shake anything up. And then I'll have to find you. Okay.
All right. Any better?
Yes, we're good to go now. Thank you.
I'm back.
Good return.
Where did you lose me?
We lost you at the policies.
Yeah.
Do we have policies in place?
Oh, perfect. Yep. So if you have policies in place to support high quality documentation, that's a great preparation for an audit or for indicating or showcasing that you are compliant with any regulations. And are there any financial, business, or administrative practices that you should improve, and what support would you need to make those improvements? And as you come to the table, some things to clarify include what are the CCO's requirements around insurance, so your own insurance for your organization.
I think we,
and
oh,
how
now you're
often,
back. We dropped off for just a second, but now you're back. Sorry.
All right. I'm gonna try to keep my my headphones are just getting wound up. And additionally, how often will the CCO expect to conduct any audits or trainings or support visits? So these are all the great questions to make sure you're clear on over the course of the contracting work. Let's pause there for any questions. I see some in the chat. So Tiffany, I see your question around, can any organization be contracted to provide services? As long as the organization is meeting the provider requirements, Stephanie briefly mentioned during her portion, in which we went into a little bit more depth. Yes, there's a broad number of organizations who could qualify to provide these services. So it doesn't have to be a stereotypical community-based organization. It could be a number of provider organizations that provide the HRSN benefits and are able to meet these requirements. And that gets to, Natasha, your question around, can government entities be qualified as a CBO to deliver services? Yes, and in fact, I think there's several opportunities both for direct government department agencies and community action agencies to participate directly in the provision of this benefit. So I think, again, same provider qualifications, same kind of focus on delivering the services, but again, really big tent around who can provide this. And Natasha, your follow-up question, can CBOs restrict service delivery to an enrolled client pool? So you serve individuals with developmental disabilities, and so they'd be exclusive to that population. So if I am understanding the question, Natasha, you're wondering if the CBOs can say we are only going to provide HRSN services for a certain part of those transition populations. And if that's who you serve, that should likely be okay. I'm not going to speak for the CCO that might be contracting, but I think what you described is likely really attractive to CCOs in areas that you serve, because they'll be really focused on wanting to support that population with developmental disabilities. So if that's who you serve, I bet that the CCO is going to want to meet you where you are, so just the same way that you're meeting your clients where they are. And I'll end before I go into this last section here on Mike's question of, does the business associate relationship eliminate multiple releases of information, and will one release of information complete blanket coverage? So that element, Mike, is definitely going to be part of the description in the business associate agreement. That's going to establish some rules of the road, and what it will likely do. Again, while I can't speak to the specifics of every CCO's contract, it will likely establish when consent must be obtained from an individual, and in what circumstances that initial consent or that isn't needed or is not needed again. So again, the business associate agreement will get into those level of details so that you can go with confidence in understanding when is consent for transmission of information required and when is it included within the scope of the contract. Great question. All right, if we happen to not get to all these questions as we go through, we will make sure we get them another time. So the last section, as we go into this, is just to share more broadly some lessons that we've learned in partnering with CBOs and having contracts with them. And these are just expectations that may or may not be worthwhile to you, but these are just our lessons learned over the past 3 years in working with partner CBOs in our regions. But establishing a contract takes time. It's not a single day event, and negotiating and being really clear on that information is so important. And in fact, it's the basis of establishing a strong partnership. Well, we encourage you to approach your contracts with CCOs, not just as payment relationships, but as that foundation for a strong partnership over time that can build likely beyond simply the HRSN benefit. And so you should be able to ask for and offer training and technical assistance and mutual learning and support. I can speak to several CBOs that have changed the way that Care Oregon thinks about the delivery of services. And that mutual learning and that sharing from their perspective was so valuable to us. So please don't ever hesitate to kind of speak up and let your CCOs understand where something might not be culturally appropriate or not reflective of how CBOs function. This is a learning space, and you should feel comfortable voicing that. Because we have unique ways of serving each other, it's also important to keep asking questions. You won't understand each other at the conclusion of your contract, but that doesn't mean that you won't ever understand each other completely. That partnership over time can be really powerful, and we found that with our CBOs with whom we partner. And because this work is still new and we don't have all the answers and won't pretend to, we need to approach our partnerships with flexibility and humility. So those are a lot of our lessons learned around CBO contracting, with a few others before we kind of wrap up and point towards some of the supports that might be available as you think about the payment, covered services, data privacy, and compliance elements. We have worked really hard wherever we can to develop intentional and consistent communication. I think that's critical to success. So another thing to consider as you think about that strong relationship as being more than just a payment relationship is what that communication could look like. We highly recommend having a main point of contact at the CCO that helps make navigating complex organization structures really easy. If you find yourself having 5 or 6 points of contact and you're not quite sure who to go to when, that's something you can ask for, to say, who is our main person at your CCO, so that we know that when we ask that person a question, they can find the right person, colleague at the organization to answer it. Maintaining consistency also on your end as an organization and who participates in conversations always leads to more meaningful discussions. Try to avoid situations where you're sending different people to different conversations. I know this can be really difficult. Sometimes there's staff turnover and it can't be helped, but the more consistency that you're able to provide to that process, the faster and more smoothly it's going to go. And finally, bringing transparency about what is needed for a successful contract and a successful partnership is essential, and is ultimately why we wanted to do this final webinar of the series and give you some insight into what to expect, so that you have some transparency into how CCOs might be thinking, and so you can reciprocate with some transparency in how you're thinking, questions you might have around any of the elements that we described here or others that might come up in your contract. You might be thinking, I'm not sure how we are going to be able to support this. We might have some gaps in how we work and how we deliver services. Or maybe I'm a little bit worried about one of these elements. We're not familiar with HIPAA or data privacy. If you are thinking one of those things, if you feel like there's a gap or a need, very shortly, CCOs are going to be bringing more information to your communities around HRSN capacity funding grants. So if you were thinking around technology that you might need some software or better support to make sure that data is secure and that documentation is high quality, and that finally, that really just kind of hit you as we talked about some of these details you might expect in the contract, a technology grant is one way that you can meet that need. But if you also need support around developing a business practices, workforce development for the roles that you might need to deliver these services or other education, these are all options. And so we encourage you to think about the details of those needs, so that you're prepared for when your CCOs communicate with your communities that the capacity funding is available, and that you are able to submit requests for a portion of that grant funding to support the infrastructure build and needs of your community-based organization. So I'll pause there. I think that's the end of the content here. And it looks like there's one more question in the chat, or Chris is asking me to clarify whether you should be asking for a main point of contact for each HRSN service. One person for all this is a lot. It sure is. And maybe it's not always possible, but I don't think it ever hurts to ask Chris to say, we would like to have one person supporting us as our contract person, as somebody who's making sure that we have what we need and that we can have a clear place to ask questions. It might not be possible, but it never hurts to ask. Any other questions that folks would like to ask, either verbally or in the chat? We'll pause for just a minute.
Hi, can you hear me?
Yes.
Um, I'm the person that asked about the developmental disability question, and I'm with Multnomah County Developmental Disabilities, and I think this would be an awesome partnership for us to, create. I believe in the last session you said that funding for staff to administer the rollout of the services and, make everything happen was available for potentially like the first 12 months. Is that accurate, or is there some way to fund like the staff to actually administer the services like on an ongoing basis?
Yeah, that's a great question. So you're asking, so for example, you might be providing rent, but what about all the work to make sure that the rent gets paid? Am I understanding the question correctly?
Yeah, I mean, every housing grant we have just comes with, the administrative burdens. And I know that our management is going to ask that question, how are we going to staff the rollout of the services? And is there
Yeah.
funding to pay for staffing to do everything involved on the back end and administering things?
Yeah, absolutely. So within the fee schedule provided by the health authority, there are a number of services that likely fit. The broad category is labeled outreach and engagement. And it has a set fee schedule for that kind of engagement of the member and support, whether that's directly, counseling with the member or doing that administrative work on their behalf. So there are funds that are available available to meet that exact need. So the fee schedule is not just for the rent or for the meals or for the air conditioner, but also for the engagement of the member and the support needed to do it right. So the short answer is yes, and then the details are definitely forthcoming as the fee schedule is put together. But we do know that for sure, that there's support for the human work that it takes to deliver this benefit.
Thank you.
All right. I'm seeing a lot of questions in the chat here, so I'm going to try to do my best here with the last 2 minutes to answer a few of them, and then we'll make sure that we get answers for any that I can't get to. Michaela, looks like you're asking, will we be seeing a sample enrollment or what the actual experience will be like for a participant? I think that's a great clarification question that you should be asking. You deserve to be able to kind of see and understand that. The details to answer some of that are still not yet developed, but that's a great idea, I think, for maybe future opportunities to work either with particular CCOs or whether there's maybe another webinar like this that we can put together once we have some ideas there. Each CCO, each region might be a little bit different there. So that might be a great thing to ask of your CCO once they've determined how they want to support that and what it might look like. And I would suggest asking sooner rather than later, because that way you could have feedback on the process itself. So just a little plug for me to be squeaky. I will go to one more question and we will, great invitation from OHA to give feedback, there we go, on the process and the details. And then I'll end then with missing here is funding for capacity building that's also available as part of the 1115 waiver extension. I think I covered some of the capacity building funding, but I'd welcome you to come on verbally to clarify if there was something I missed.
Nope, and sorry if I missed it, but yeah, I didn't see it on the slides. I only saw 3 priorities, climate, housing, and nutrition. So I wonder why outreach and engagement was left out.
Oh, exactly. Yeah, that's kind of the glue that makes all of those things happen. So thanks for calling that out, both to you and to Natasha. That outreach and engagement around those services is definitely included as a component of this benefit. I really appreciate that. All right, I think we're going to close because we just need to wrap up here. And any other questions, we'll make sure that we see them in the chat, that we will get those answered to you in the notes after the meeting.
Awesome. Thank you so much, Dave. Appreciate that. And so just so everyone knows, the follow-up survey link can be found here. It will also come in an email to you after this webinar. And then you can also visit OHA's 1115 waiver webpage You can go to the YouTube channel, like we said earlier, where the recordings have been stored. And then also just be on the lookout for more conversations related to this. This is a constant evolution. It's definitely not set in stone at this point. And so definitely sounds like opportunities for more input is available. So we would love to participate in that as well. So thank you so much, both Stephanie and Dave, for your presentations over the past 3 series and your time. And thank you to all of you community for attending and just being open to this conversation. We appreciate all the work that you do day in and day out. And we will follow up with the recording and all of the information noted. Have a great Wednesday.